Dear all, in continuation of the chapter of post-mortem changes, last session we have discussed regarding the Kevorkian sign, that is the changes in the retinal vessels. So, simply it is the fragmentation of the retinal vessels which are present in the eyes after death, and it is usually considered as the earliest sign of death, and also it is used to determine the time since death. So, before the Kevorkian sign, the corneal reflexes are lost and the dilation of the pupil will be there. Next, coming to the chemical changes, we are going to find out what and all are the internal chemical changes that happens in our body after death. So, coming to the vitreous humor changes. Okay, so it is the important medium in the eye which resists the putrefaction, that is decomposition, and there are no chemical changes in the vitreous humor after putrefaction. So, it is one of the the component in our body which resists the decomposition after death. So, it is the best medium to estimate the time since death. Okay, so here even in an advanced decomposed body, the vitreous humor is very helpful in determining the time since death. Okay, so the best parameter to check for the chemical changes is the vitreous potassium levels. Why? Because there is a linear increase in potassium and hypoxanthine just after death, and it will increase steadily. So, the presence of this value of this potassium level and the hypoxanthine level in the eyes can also be used as an important determinant of time since death. Next, coming to the continuation of our post-mortem changes, we have something called as the algor mortis. So, in simple words, algor mortis means cold of death, which refers to the gradual cooling of the body after death. So, this algor mortis, it is derived from the Latin word meaning algor means coldness and mortis means of death. So, it is defined as the internal cooling of the body after death to an ambient temperature due to the cessation or stoppage of our thermoregulation. Okay, so algor mortis is one of the earliest and most widely used phenomenon to estimate the time since death, or in short the post-mortem interval. So, by assessing the temperature of the body, we will have an estimated time since death. So, how did the loss of body heat occurs? Okay, so the cooling of the body, which is also called as the chill after death, it is a complex process and it does not occur at the same rate throughout the body. We will see how the process or the mechanism of algor mortis starts in the body after death. So, after the stoppage of circulation, means after the blood has stopped flowing in our body after death, then the transport of the heat inside the body, it stops. Okay. So, even after death also, there will not be sudden cooling of the body. Why? Because there are two main reasons why the sudden cooling of the body is not there after death. So, first one, heat is generated from residual metabolic process, example a glycogenolysis of the dying tissues, and second one, the metabolic activity of the intestinal bacteria. That is why these are the two main reasons why the body does not cool down immediately after death. Okay, so here in this chart we will get a brief idea about what and all had happened after death. Okay, so usually the livor mortis, that is the post-mortem staining, then algor mortis, that is the gradual cooling down of the body, then rigor mortis, that is the stiffening of the body after death, then decomposition. So, usually as the chart indicates, decomposition usually starts after 18 hours after death. So, the loss of the body heat occurs by conduction, convection, and then the evaporation. So, in conduction, it is a process by which the heat or the electricity is directly transmitted through the material of a substance where is a difference of temperature or of electrical potential between adjoining regions without the movement of the material. So, in short, in conduction, the heat loss will occur, or the heat or the electricity, the transfer will occur without the movement of the material. Then the exchange of the heat between the core and the surface of the body occurs only by conduction. Since there is stagnation and immobility of the body after that, that is why the heat loss is happening through the conduction without the movement of the material. So at first the heat loss is from the superficial parts of the body, and due to low velocity of the heat transfer from inside the body, more time is taken for the heat loss from the deeper layers of the body, and internal organs usually they will cool by conduction. So conductive heat exchange occurs due to temperature between the body and the surrounding. So example, clothing, covering air and water. So these are some of the factors which are going to affect the cooling of the body. So the heat, body heat is mostly lost due to conduction and convection. Why convection? Because it is a type, since it is a type of heat transfer that occur from the movement of the fluid. So here in the body it's like it is the liquid and the gases. Then next, heat exchange by radiation is extensive only for the first hour and decreases later depending on the rapid decrease in the skin temperature. So only a fraction of heat is lost due to evaporation of fluid from the skin. So for about half to 1 hour after that, the rectal temperature falls to little and not at all. So here to check the algor mortis, that is the gradual cooling of the body after that, the rectum is the ideal place for the checking the temperature. Okay, so the curve of cooling is sigmoid or inverted S shape in pattern because of the residual enzymatic activity and retention of heat for some time. So in serious illness, the circulation will even begin to fail before that. So the hands and the feet will become cooler than the rest of the body, and after that it will spread towards the trunk. So in case of sudden deaths, the cooling starts just after death. So coming to the measurement of the temperature, the rectum is the ideal place to record the temperature except in cases of sodomy. So what do you understand by sodomy? That we will discuss later in the next session. Thank you.